And we're back, dear viewers, to welcome our guest. Our guest is very special because she works in a career that everyone who's watching us, of course, do actually feel terrified when it comes into visiting her more often. For me personally, I really enjoy visiting this kind of department when it comes into hospitals because I really enjoy that treatment. With us, we would like to welcome our doctor, Dr. Amina Aljassem. She is advanced general dentist at Asnan Tower. Really happy to have you here.
Thank you for having me, and thank you for this amazing opportunity.
We're glad to have you today with us and to talk more about, to be honest, our teeth and how we should take care of them. As I remember in the primary school, we used to be afraid to go to a dentist. So I would like to know, or if you could tell us, at what certain age we should start going to see a doctor, or we should take care of our teeth more.
Okay, so seeing a doctor or a dentist specifically is not only about treatment. So when you're a little baby, when you have this first tooth, this tooth also is prone to get cavities or anything else, or like any developmental and growing anomalies. So once you have the first baby tooth out, you need to take your baby to the dentist. Not because he needs treatment only, but also to desensitize him and make him feel more familiar with the setting and dental chair and the treatment. That's because you don't want to develop like a later, like a behavior, or I mean a trauma for the patient.
Yeah.
Like everyone is scared of the dentist.
Yes, because this is really true, especially that if we go back in time and remember how it's cool, to be honest, when they used to come and treat us. I was always, like my mom always used to take me for a certain checkup. And then I always used to tell them at school that I did my checkup. Why are you checking more? So I was really terrified because of the old, way where they actually let you sit, and if you have that bad behavior, they used to
strain
strain you. It was really terrifying. But I had that experience with my child. Like, she always tells me, Mom, I want to go to the dentist. I didn't ever tell her that you need to, let's say, it's a scary place, or I terrify her. No, I immediately take her, do the normal checkup. That encourages her more.
Actually, trauma happens for two reasons when you're a kid. First of all, because you're not used to the setting and you don't have a good experience with the dental chair. Usually, the parents take their kids when they're in pain already. Like they're already in pain, they're already anxious, and they have totally a new, different environment with more pain and sounds and things that they don't know, can't comprehend.
Yes.
So it is traumatic for them when you take them with pain already. But when the child is happy and pain-free, and he can just go and have some fun, and he will look at it as a positive experience more than a negative one. So that's how you develop it usually, and that's one of the reasons why the dentists had like checkup routines back in the days. I don't know if they still do it in schools.
Okay, doctor, please, if you would kindly elaborate and show our viewers what's the best way of maintaining teeth whitening. Is it through having a laser specifically done at the clinic, or by taking at-home kits? And how to prolong the effect of having, that Hollywood healthy white.
Okay, so this is the most famous and popular question I get to be asked in the clinic. Like almost every day I explain it. Teeth whitening is it's temporary. It's a very nice treatment because it has a good outcome, and it keeps your original teeth in a nice form. I mean, you don't have to go for cosmetic treatment or anything. When the teeth are healthy and they are free of fillings, especially I'm talking about front teeth, not the back ones, but the front teeth, because these are where the smile shows. So whitening is a good way of having this nice smile, but it's a temporary one that it needs maintenance. So there are different kinds of teeth whitening ways that you can do. You can have over-the-counter the whitening strips, if you know about them. these have very little concentration and they don't adapt very well to the teeth. So they don't actually give you the results that you want. But they're okay. They're okay to use and they're very safe also. The other thing is the laser that you mentioned. It's not actually laser, it's more of a high intensity light. But what we use in the clinic is a very high concentration of the whitening gel. So it gives you instant results, and that light also accelerates and gives you faster results on the spot. These I don't recommend it usually for like just keeping your teeth white all year long, because the effect doesn't stay for a long time. You have to maintain it at home. I would recommend that if like you don't have enough time, or you have like
sometimes also you might have like sensitivity from the teeth
itself.
Actually
all kinds of whitening can cause sensitivity. We have ways to manage the sensitivity, but it's usually there. It's just because, like, to put it in very simple words, the whitening gel opens up the pores of the tooth, so that it goes in and changes the color. And these pores stay open for a little bit, like a couple of days. And then, like, fluoride toothpaste and your saliva and food would just close them up again, and the sensitivity would go away. So almost all kinds of whitening has the side effect of sensitivity. But it's controllable and it's reversible, and it's like it's okay. I mean,
and that's the reason why they advise patients not to drink, I think, coffee or tea during that time of treatment, because of these.
That's the exact reason. Yes.
But you're now in the afternoon tea, so we're going to present for you some tea on, let's say, in our show, and to discuss more about it indeed. Yes.
Speaking actually, I was just going to say, speaking of coffee and tea, because this is something we usually have on the daily, and last week's topic was about coffee and tea, so check that out if you haven't. But so if we have tea and coffee daily, what is some kind of at-home, very light remedies that maybe we can even use in the kitchen, just with things we have in the fridge? Are there such things?
There are some, let's say, stories, or I don't know what you call them, but myths maybe, that banana skin would, if you rub banana skin on your teeth, I don't know if I'm
also
right.
Charcoal and I don't know.
Charcoal,
we've heard of that,
strawberry, I think.
Even the baking soda.
Baking soda.
About baking soda.
I don't recommend using any random stuff, because we have always have to have a scientific backup for stuff. I can't recommend.
But I think maybe in the past they used to use these kind of products.
Because when they don't have, they didn't have enough evidence, and they would go for something local, or something at home.
Actually,
they would use salt, they would use charcoal, they would use strawberry, but what and they work. To be frank, they work, but not in a good way. Because charcoal and salt and rough things would like scrape off your tooth and would make it prone more to stains.
Understandable.
So there are some toothpaste that has charcoal, but it's a very soft one. And I recommend it for my patients, especially with the ones who drink tea and coffee all the time. It's just like to lessen the stains on the surface of the tooth. But you don't make it your main toothpaste. You use it like a couple of times a week, or 3 times a week. It depends if someone is a smoker, if they drink a lot of black coffee or tea. It would help reduce these stains. But actually, you need to go for a maintenance visits for cleaning and checkup and whitening.
How often would you recommend these visits to the dentist for cleaning?
Ideally you should go biannually or twice a year, every 6 months, for a checkup and for a scaling visit with whitening if you want. But some people need it more often than others.
Makes sense. And I heard also I heard also that there's if you don't go regularly, you can even grow some unhealthy bacteria on the teeth. And
oh god.
I've actually heard some horror stories with that. What are the best ways to avoid, I guess, bacteria buildup?
Actually, what builds up on the teeth, we call it calculus or plaque. these are reservoirs for bacteria because they are food remnants. They can be, they're made up of a lot of things that bacteria likes to grow on. So if you keep them there for a while, the bacteria, of course, they're going to grow with them and will cause gum disease or cavities. The best way to remove them is cleaning. I mean, in the house, teeth brushing for twice a day with flossing once a day, and every 6 months visits for those spots where you can't keep or maintain very clean at home.
That's fantastic.
So, yeah. That would give you a lifetime of healthy teeth. I mean, they're very simple, but I don't know, for some reason people like neglect them and they don't do them.
Maybe they're not educated about dentist like culture. I think because in the States it was regular. Like when we lived in America, it was every 6 months you go to the dentist, and it's the same dentist. But I don't see the same thing here.
I see the big difference when working in the clinic. Like, if I go in the clinic and I'll see an American, or not specifically American, but like any other Western culture, they have this. I would just ask, what's your reason for your visit today? He would say, I just moved in and I just need to find myself a dentist. And I love this. It makes my heart so happy.
That's the most challenging thing, because it is very important to find a good dentist, and not only a good dentist as in a good treater, but to be honest, a good dentist as in a person to not only follow up, to have that connection, you know, to have a certain doctor to actually go and visit. And that's why we like Asma, to be honest, because they do actually present to you this kind of environment, that kind of friendly friendship between you.
They're more like a family, even to us, actually.
Yes, indeed.
Since we have this fear of a dentist, I think young age or older age, when you go to a place and they're friendly and you feel like you're in a comfort zone, safe hand, you would feel safe while you're doing your teeth.
Indeed.
Since we have talked about whitening and smokers and maybe people who drink tea and coffee, as we can see lately, most of the people have the dental veneers. Okay, so we would like to know more about the veneers. And is it certain like everyone can do veneers, or there's like a special cases?
Okay, so this is what I do actually in the clinic almost every day. Cosmetic is a big part of dentistry, and not only the treatment part, but also cosmetics. And people has been focusing on cosmetic part all over, I mean, the medical field, not only dentistry.
Yes, indeed.
And I think the trend of Hollywood smile or whatever white aligned teeth has gone viral for the last few years, and the people, they did have some misconception. There are some, we deal with ceramics. We use the ceramics to make your teeth look better. Sometimes not only for looks or cosmetic only, but also for treatment. Because whenever a tooth has a big cavity or has a big filling or destructed or had a root canal treatment, it's weaker. And sometimes we need to protect it so that it can last for you to use. So what we do is a crown, what you call, I mean, in basic English is
cover
caps.
up basically
caps. So dental crown is a full coverage. We cover the whole tooth so that when you eat or use your tooth, it's the pressure comes on the ceramic, not on the actual tooth, and so it lasts longer. But this serves also another purpose. It makes the tooth looks better. Veneers is actually purely cosmetic. There's a side of it that, like, some people would be born with a defect on their first layer of their teeth. It would also, we'll go back to a cosmetic. Because it will also do a problem for, they will make them have a cosmetic problem that we can deal with veneers. So veneers is a really good option. I mean, it's a really good one if your dentist is, let's say, is good on handling and
know
he knows
how
his
to
stuff.
deal with
Yeah,
it.
he
Yes,
knows
how to do it, because it's really critical.
The competent dentist would do a life-lasting veneer.
Okay, you know, Dr. Amina, there's just some concern when it comes to having veneers, that I think a lot of people have this fear of having their whole teeth shaved down.
Yeah.
So is this necessary? Is it a must when it comes to having cosmetic work done?
Okay, so we have the prepless veneers, but not everyone is suitable for the, not every case would suit the prepless veneers.
Okay.
But that doesn't include shaving or reducing the tooth. But usually we need to make some room for the ceramic, so that it doesn't accumulate food and would, cause you gum disease.
Yeah.
And the other thing is sometimes you use the veneer to realign the tooth or change its shape or length. And then you need to create some space, and you need to have a good solid structure for the veneer to go on and make it look better.
Actually,
so usually reducing is important.
recommended.
Yeah, it's recommended.
Actually, doctor, if you would kindly elaborate on something. For me, to maintain healthy teeth and to prevent staining, I usually drink coffee and tea using a straw, an aluminum straw, to be eco-friendly. Now, when it comes to veneers, do they get affected the same way as natural teeth when it comes to staining?
Okay, so veneers stain slower than the tooth, because the tooth has its own characteristics. It has like roughness to it. It has some grooves in it. So that these spaces would accumulate stain faster. But when it's really highly polished, it's slower to accumulate stains, but they do stain.
Yes.
They don't change in color.
Yeah.
You don't have to do whitening or, like the natural tooth, but they do stain. It's a surface stain that you can just polish and go back to your original clean, spotless veneer.
And in the end, to be honest, everyone should take care of themselves, especially when it comes into their teeth, whether they're veneers or natural, because at the end, the smile is the most important thing, and everyone would be actually watching you when it comes into that. So, Dr. Amina, thank you very much for your time. It was really a pleasure having you here.
Thank you for the tea that I did.
Yes, though you're a dentist and you recommend the tea, not drinking tea too much to maintain that whiteness, but in the end, we're really happy to have you here, and it was really a pleasure having you. So thank you very much.
Thank you so much for having me.
Thank you. With that, dear viewers, we're going to continue the rest of the episode. We're going to head to a break, and then we'll be back.